line today, especially the local officials that we want to reach out to and try to answer a lot of your questions and provide you a lot of information and just try to connect the dots as much as we possibly can. Before I make a presentation and before we start getting to the questions, I do want to let everybody know several people who are on the line with us who are also going to be participating and answering questions. We have Congressman Kevin Brady, who was intricately involved in the crafting of the legislation that's providing so much financial resources to our community. We thank him for his leadership in Washington, D.C., but also we thank him for his time spending with us to help us understand what the funding strategies are and how they can be tapped into and how you can use them to help your community. Also, as some or all of you know, you provided us some questions in advance that we will be getting to here shortly. We wanted to do that so we can kind of expedite this so we can try to answer as many questions as possible. If we work through the entire list that we received, we will open it up for more questions. We'll tell you how to do that later on. But I'm using that to explain to you that we also have on the phone some other people who will also, who for one, they've been working with us every step of the way, but also will be helping to answer questions today. They include the Attorney General, Kim Paxton. They include the Doctor for State Health Services, Dr. Hellerstedt, who's the lead doctor for the state of Texas in this operation. They include Phil Wilson, who is the head of HHSC. There are some questions involving the Health and Human Services Commission. And then we have Brian Daniel from the Texas Workforce Commission. I know I get, and we all get a whole lot of questions about, let's say, unemployment benefits and things like that. And we want to make sure if you have those questions are answered. And we have here in the room with me, Nim Kidd, Chief of the Texas Division of Emergency Management, and a team of other experts from my office to make sure that we're going to try to be able to answer all of your questions. If there are questions that are not either that we have time to get to or that we don't have a ready answer to, we'll get you the name of a person and email address to submit that to. But that said, let me cover some ground up front to give you some facts about it and where we are and give you some context for it. And then I'm going to talk about a couple of issues and then start going through a long list of questions that many of you have already submitted. I want to let you know kind of where we are with regard to the number of people in the state of Texas who have contracted COVID-19, what that trajectory looks like, deaths, and some other things like that. So as of earlier today, there had been almost 89,000 people in the state of Texas who have been tested for COVID-19. So you'll know our ability to do testing has increased dramatically over the past week to 10 days. We are increasing the number of people tested by a daily compounded rate of more than 10% per day. And we will hit the 100,000 mark later on this week in the total number of people tested and just continue to expand from there. Including in that testing are some testing supplies that are provided by government. But a lot of the testing taking place these days is on what I'll call the private sector side. What I mean by that, there are in various locations across the state of Texas some drive-through lanes that are provided by hospitals as well as other local authorities that are in addition to the FEMA drive-through lanes that are provided in certain geographic regions. Also, local doctors now have increased capabilities providing testing for COVID-19. In addition to that, some of you may have heard about the 15-minute test by Abbott Labs that has come out. Last week we got, I think it was 15,000 units of that. And this week we are receiving 20,000 units, and we will be receiving more each week. And those are, it's my understanding, pre-designated by Abbott Labs to go to private healthcare providers at, I think, 44 different locations across the state of Texas. And we are working with Abbott Labs to try to both get more of those tests and more locations for those tests to make sure everybody's going to be able to have some level of access for the quick turnaround on those tests. So going back, we tested about 89,000 people in the state of Texas, and there are, as of earlier today, 8,083 Texans who tested positive. And so from the beginning until today, the ratio of the number of people who tested positive has remained roughly the same to the number of people who are tested. And that is, it's always a little bit less than 10% of the people who are tested test positive. Conversely, that means that more than 90% of the people who test negative, which means they don't have it. We have confirmed, as of today, 1,252 people who have tested positive who needed to be in a hospital. And so, again, that ratio remains pretty low. And unfortunately, the number of fatalities continue to increase. As of earlier today, the total number of fatalities in the state of Texas is 158. There is additional information I want to provide you about hospital beds and things like that, but it's not on the sheet that I have in front of me. I need the sheet that has all of the hospital beds available, but I'm going to go off of memory right now. We rolled out information about this earlier this week and late last week. And what we let people know is that as of yesterday, there were 21,000 hospital beds available statewide, which is right now more hospital beds than what is anticipated to be needed for purposes of responding to COVID-19. We have 2,223 ICU beds that are available, which again is more than what is prognosticated that will be needed. We have more than 7,000 ventilators available to us in the state of Texas. And so one reason why that healthcare facility information is so important is some people have worries and concerns about if Texas is dealing with a situation like what we have seen in New York, and that is that we're running out of hospital beds, we're running out of ventilators, we're running out of capability to be able to handle the healthcare needs of the people of our state. And the answer is if Texas and Texans continue with the current mitigation strategies to reduce the spread of the coronavirus by doing all they can to stay at home with the exception of essential services, we should make sure that we will be able to stay within our current hospital capabilities, and no one will be facing situations like what we see in New York. I do want to add two caveats to what I just said. I have two concerns out there that we all must work on together. One concern is, just as usual, the larger communities have more hospital beds available to them on average. There are some smaller communities that are very well stocked. But for those of you who are in the smaller communities in rural Texas, if you ever have concerns about your hospital bed capabilities, your ICU capabilities, and if you don't have a strategy in place to deal with that, I urge you to get a hold of our office so that we can pregame this out with you to make sure that you will have the resources you need and the strategies that you need to be able to respond on a moment's notice to deal with this. Secondly, we have seen over the past week or two an increase in the number of what I'll call vulnerable population facilities, with having a large number of people in those facilities test positive. What I'm talking about is this. There was a rehab center in Victoria yesterday where this happened, where there have been certain senior living facilities, call them what you want, nursing homes, senior living facilities. There was a facility in Denton, which was a state-supported living facility. These are all very vulnerable populations. And all of us, whether it be the state or at the local level, we need to be extra vigilant, doing everything that we can to protect those populations in those group settings from contracting COVID-19. Now, in my executive order, I prohibited anybody other than the employees and staff from going in and out of there for the reason to prevent anyone who may have exposure from COVID-19 from importing that COVID-19 into those living facilities. We need everybody's cooperation because it's a whole lot easier to contain this when we have a family of four at home, staying at home, than it is in these large senior living facilities. And that's where the outbreaks can occur rapidly and where the consequences of people testing positive are more serious. And we have to do everything we can to protect those populations. A couple of other things, I'll be getting to the questions. One thing that I know that a lot of people are curious about, and that is, are these stay-at-home measures working? And according to my conversations I've had with Dr. Hellerstedt, but also conversations that I've had with these doctors you see on TV with the president, Dr. Fauci, and Dr. Birx, they all say, yes, the mitigation strategies work. But they also add one clause after that, if they are complied with. And so the good news is we are achieving success over the past few weeks by people across the entire state of Texas following these mitigation strategies to stay at home to reduce the spread. But all our efforts we put in so far will be a complete waste if we do not continue this effort through the April 30 time period where we can maximize the reduction in reducing spread across the state of Texas. A question everybody has, and I'll just front run this one, and that is PPE. I know that there is an ongoing need for PPE. The good news is that we have established a high-level, very effective supply chain operation that's being led by someone on loan to us. He is the Senior Vice President for Worldwide Procurement for Dell. And he's using a top-notch private sector strategy with connections across the globe to help us tap into supplies. And as an example, there are a key component of supplies, of course, are these masks. And over the past 2 days, we've been able to assemble and begin to distribute almost 5 million masks across the state of Texas. And then on top of that, there is a large number of face guards, which are the big plastic guards that some of you may have seen, hundreds of thousands of those, as well as millions upon millions of gloves, as well as hundreds of thousands of the garments that people wear. So the good news is that through the effective strategies used by our supply chain team, we both have a large amount of PPE that we are shipping around the state of Texas as we're speaking right now, with good visibility for even more PPE coming in the days ahead. We know that we never will have enough. I say that. Candidly, with what we are able to assemble, it looks like we will have enough. We will be in good shape. Let me rephrase what I was saying. I know that you all feel an ongoing need for PPE. Just continue to reach out to, is it NIMKID? Who's the person they reach out to? You reach out to NIMKID to be sure and let him know what your PPE needs are. There are some who are dealing with situations where there's been an outbreak at one of these, let's say, senior living facilities that has a more urgent need, more immediate need for PPE, like you need it yesterday. You're out of it. And we have to triage and prioritize those first. But we have statewide shipping capabilities immediately and can get your needs met immediately right now, and as those needs continue to rise. Let's see. Also know this with regard to what we're doing with the deployment of the PPE, and I'll have somebody correct me either now or later to the extent what I'm about to say is incorrect. But a lot of that PPE is being deployed directly to providers, not just to governmental jurisdictions. There are some governmental jurisdictions to which they're provided, including first responders, law enforcement, and public health authorities. But we're also making sure that we're providing to the doctors and nurses on the front lines of our hospitals who are having to respond to the COVID-19 patients. So I guess my point in telling you that is our deployment of PPE is to a group that's larger than just the subset of governmental jurisdictions. Let's see. There will be some questions coming up that are good questions about all the money coming in from the federal government, and I'm going to let Kevin Brady take a crack at answering those first. Let's see. And I'm going to talk to you later in response to questions about opening things back up. So why don't I do this? At this time, before I start answering questions directly, let me open up the mic to Congressman Kevin Brady to let him give you his perspective from what's going on, or let's say what has happened in Washington, D.C., and what it can mean for you and your community. So, Congressman Brady, are you with us right now?
I am, Governor. Thank you for allowing me to participate in the call, and thanks for your leadership response in Texas, and also for your help to people like me as we were shaping, especially this third major bill out of Congress. It was your guidance was hugely helpful to a number of us, so thank you for that. And I want to thank our mayors and county judges for just a remarkable job that you're doing here at the local level. I cannot thank you enough. Let me give you a quick overview, including dollars that are headed down to the states and local communities to help offset some of the lost revenue you've seen. So as you know, Congress passed three major bills. The first was focused on accelerating vaccines and treatments. You're seeing the result of that right now. The second was focused on making sure people could get tested at no cost, that people would get help on family leave if they were sick or had to take care of loved ones. Also, there was a bump to Medicaid because we know states and local communities are going to see demand there as well. And then a little help for states to prepare for greater unemployment rolls. But the third bill is the one you're most familiar with, CARES. It is focused on saving both lives and livelihoods, because we are getting hit both economically and medically. The economic support, this is $2.2 trillion. The economic support comes in the guise of the individual tax rebates that will be coming out direct deposit by next Friday, so in about 10 days. We also waived the penalties for accessing your savings accounts. We made sure seniors over 72 don't have to take dollars out of their retirement account as the law previously requires. And we bumped up the incentives for charitable giving. We think that's important. We knew unemployment would see record levels, 10 million seeking unemployment the last 2 weeks, so we expanded the scope and the help in unemployment. The scope we expanded to those beyond traditional workers who seek unemployment. So the self-employed, the independent contractor, the furloughed, the freelancer, those in the gig economy, those at state and local government levels will be eligible for unemployment. We increased unemployment $600 per week across the board, and then for the states that may have a little longer time coming out of this economically, extended unemployment by 13 weeks. We know at the heart of this economic crisis, it's a cash flow crisis. That's why customers are disappearing. That's why we're seeing the layoffs and the closures. So most of this bill was focused on injecting cash into businesses, large and small. We do that to the major industries through just direct loans to airlines, to defense, to energy and companies. These are loans that have to be repaid. There's certain conditions. It's not a bailout. They did nothing wrong, but that's being handled through the Secretary of Treasury. Most of you, our local businesses, are using the small business help, $350 billion, mainly through these paycheck protection loans, which are forgivable loans that can be used for payroll, for rent and mortgage and utilities, that are based on how many people you have on your payroll now and can be forgiven depending on how many are on your payroll by June 30th. So the goal of that is to help local businesses keep their workers close to them and keep them enrolled. So far, and it's a little unbelievable because they rolled this whole federal program out in 7 days, which I've yet to ever see before. At the end of the close of business today, likely $50 billion through 3,000 local lenders will be in local communities. The president, as we speak, has just asked for another $250 billion so that local small businesses and local lenders can sort of have peace of mind that there'll be plenty of dollars there to help them through this cash flow crisis. We're also providing an option for those who don't use the Paycheck Protection Loan. We do have a worker retention credit focused on businesses that were closed or partially closed because of a local or state mandate directive, or who've lost more than 50% of the revenue. They are eligible as an option separate from the small business loans of a refundable credit, which means dollars immediately, where if they pay half of the first $5,000 of wages, we'll pay the other half of that. That's just another option for our local businesses. We know cash flow matters, so we're deferring the payroll taxes for every business to the end of the year, and they'll have 2 years to pay that back. Then we're letting them take their losses from right now against their last 3 tax returns so they can get cash immediately. Both of those provisions are another $500 billion into local communities rather than Washington. And then the final point, and the one that the governor wanted me to highlight, was we know our healthcare community, our schools, especially our states and communities, are incurring major expenses. And so $340 billion was appropriated to help you. $100 billion coming to hospitals, public entities, not-for-profit entities, Medicare, Medicaid suppliers to help with the cost of health care. $30 billion to our schools and colleges to offset the distance learning and additional costs. And then $150 billion has been set aside for state, tribal, and local entities. The goal is to help you offset some of the lost revenues as a result of this coronavirus emergency. It will flow down by population. So Texas will receive $11,250,000,000. Entities with a population of over 500,000 are able to apply directly. So in Texas, by my measurement, that looks like 5 cities and 12 counties. The others will work through the state for pretty obvious reasons. A state like us has 1,200 municipalities, 400 towns under 1,000, 254 counties. You have an existing relationship with the state that you don't with the federal government. This just lines it down to you. Treasury is still working through several questions I've gotten from my local entities. For example, if a county and a city are both eligible for the funds, who will gain preference? That's a pretty key question. We expect guidance from the Treasury Department by Monday, April 13th. That's their goal. They expect, so we'll know more about that program and the rules by Monday. They expect to be moving quickly, sending the money out by Friday, April 24th. My point to you is look, this situation remains very fluid. Treasury has been incredibly responsive to us on some of these conversations on how we answer questions and streamline the dollars coming down to you. But there are still a lot of decisions to be made. So I encourage you to share your thoughts with me, with the governor, and with your members of Congress. Governor, I want to close with two things. One, we're all focused on how we can help our small and local businesses survive. Well, our cities and counties can help as well. I'd recommend, review your vendors, identify payments that are due in April and May, see what you are able to defer for local businesses, because maybe a $5,000 payment that's owed doesn't mean a lot for you, but it may mean an awful lot for local business. And then finally, we're all cognizant that while we apply maximum pressure on this virus, that at some point we're going to want our local economies and state economies to rev back up. And while right now we are applying that maximum pressure, businesses in the coming weeks are going to start turning to their plans to reopen. Again, as health conditions permit, tailored to their community, to their customers, and to their workers, they're going to need to share that information with you as our state and local leaders. You are going to, I don't see this economy switch being flipped on. It will be a rolling economy, mainly decided by you. And so you're usually, my experience as mayors and judges are way ahead of members of Congress, but you probably already implemented this. But if you haven't, I'd recommend internally for now, designate some type of economic recovery task force to work with your local businesses to be thinking about and reviewing what their plans are for reopening, because that will, again, health conditions permitting, that's going to drive the economic rebound that will help not just people get back to work, revenue going, and revenues into your coffers as well. So, Governor, I apologize. I was trying to squeeze as much in there as I could.
Well, you did a great job. I want to thank you, but also I want to keep you right where you are, because there's some of these questions that the local officials have sent in that have a direct intersection with you and your information.
Great.
And so I'm going to start with these questions right now. A couple that relate, and I know you kind of covered this, but just to maybe go over it with a finer point, with a question that has come in from one of the counties in Texas, but I'm sure there may be others that have the same question. It says, all of our local banks met their spending limits yesterday and are now unable to fund many businesses applying for government assistance. Can you please assist me in where these businesses can go to find financial support?
Yeah, great question.
Sure,
sorry, Governor.
I was going to say, it has one other question. Additionally, where will the independent contractors go to secure funding since the banks have met their lending limits?
Yeah, so great question. And the answer is a few banks have hit their lending limits. Wells Fargo would be one. For the most part, community banks have not, and Treasury just announced that they would be creating a repurchasing program so they can take those small business loans off the hands of the local banks. That will allow them to continue to give them. It's been frustrating, Governor, because when a major bank chooses not to participate, it really throws a wrench in things, because you as a business may not have a banking relationship with someone else in the community. You're worried about being sort of moved to the end of the line, and it's really disconcerting. So I would do this. One, if I was a business at a bank that says they've hit their limit, stay on them, because Treasury Secretary and these banks are having these discussions right now, and I think there could be relief in sight. So stay with them. Secondly, look for a bank that you have some type of relationship with, whether you're borrowing money or not. And then thirdly, the SBA has on their site a link where you can identify the other local lenders for these loans. I know it's frustrating. Not all the lenders got up as quickly as we'd hope, and SBA had technical problems initially. They're still working through some of the adjustments that need to be made, but that'd be my recommendation. Hang tight. Stay with the bank you got to make sure that limit isn't lifted. Look for a bank that you might have a lending relationship. Check with the SBA on available local lenders.
Sure. Thank you, Congressman. I don't want to complicate this, but I kind of want to try to fully answer so you can kind of understand what's going on. So Congress did a good job of getting this out quickly on the CARES Act. Treasury acted swiftly to try to get it out. Banks had challenges dealing with the regulations, and as a result, aren't fully ready. But I'm going to add this, Congressman, that you probably know more about. But I want to read everybody here the first two sentences of a story in today's Wall Street Journal that explains a little bit more. Because banks were dealing with uncertainty, last night the Federal Reserve came out and basically announced they were working on a backstop. The heading of this article in the Wall Street Journal says, Fed preparing to finance new small business payroll loans. And the subtitle is Fed Treasury working on program to facilitate more lending to small businesses. And let me read you two sentences. It says the Federal Reserve said Monday it would create a new program to finance loans that banks and other lenders make through the government's Emergency Small Business Lending Program. The move will free up financial firms to make more loans guaranteed by the Small Business Administration's Payroll Protection Program, part of a $2.2 trillion economic relief package. And so their goal was to get money through the system as quickly as possible, and the money may be moving faster than the banks have been able to catch up with and process all the rules and regulations. Congressman, while I still have you, if I could ask, that question's been answered.
And Governor, just to your point, the recommendation to create a way to get those loans off the local bank, we had that. Much of that came from the Texas community banks. We had a phone call Friday. That was one of the key improvements that need to be made. So I'm really glad the Fed and Treasury acted pretty swiftly on it.
And thank you for that. And this may relate to you, Congressman, in part, but also Brian Daniel. Brian Daniel is the chair of the Texas Workforce Commission, and it mentions a subset of the workforce, but it could be viewed as broader than that. Let me read the question, and let me first have Brian Daniel answer, just to confirm. Brian, are you on the phone? Brian, I don't know if your phone is muted or not, but Brian, let me know if you're on the phone. If not, I'll take a stab at answering the question. Here is the question says, I have a large population of salons and spas who are self-employed, and folks rent chairs from them. What help is out there for them since they're all out of work? Well, it seems like there's kind of two parts to this question. One is that these are small businesses that may be able to benefit from the small business loans that Congressman Brady was talking about. I can't tell for certain, but there's a possibility that some of these folks may qualify for unemployment. And so let me tell you this, and that is, and this will answer some other questions people have asked. There is a record amount of unemployment benefit claims that have been filed, so much so that it's a magnitude of maybe 10 times as many as ever has been filed, and the staffing was not there to keep up with all of the claims that were being filed. As a result, the Texas Workforce Commission hired several hundred additional people. They also brought in other people from other agencies. And I want to thank the Lieutenant Governor and Speaker in Texas for their efforts to reach out to members of the Texas House and Texas Senate for them to provide staffers to assist in clearing out the backlog of these unemployment benefit claims. And so to the extent that the person would be filing for unemployment, I would urge them to continue to file, knowing a couple of things. One is we waived certain restrictions so that we were able to expand the time period during which people would be able to collect unemployment benefits. And then because of what Congress passed, it will ensure that there's going to be more benefits available to people who do apply for unemployment benefits. And Brian Daniel, I know he's on the phone, he may have more, but what I need is I need the operator to unmute Brian Daniel's line. Operator, can you do that?
Brian Daniel, if you would please press *1 to have your line unmuted.
And Governor, while we're waiting for Brian, self-employed, like independent contractors, can apply for those small business forgivable loans. Instead of a payroll, it's really your salary and expenses that make up that loan documentation.
Governor? Good. Yeah, and Brian, I had to come in, but Congressman, what you guys did to have those forgivable loans is such a game changer, and it really is going to inject a lot of speed and in the expansion of the Texas economy by doing that. So we applaud you for doing it. But it sounds like we have Brian on the line. Brian, why don't you go ahead and provide more information about this as well as the processing of unemployment benefits in the state of Texas?
Yes, sir. Thank you, Governor. It's obviously our call volumes and our internet volumes remain very high. We're averaging about 300,000 claims a week. Just to put that in perspective, we were averaging about 13,000 claims a week in January and February of this year. So obviously, that increased volume has put a lot of increased strain on both our call centers and our internet ability to take claims. We're taking 90% or more of our claims online, and we'll continue to do that. We're adding call center capacity. So please do tell people in your communities, go online, follow the instructions there. If you need to call, the ability for people to call is increasing daily, and we're adding folks exponentially to do that. 90+% of this can be done online. The only reason you might have to call in is if there was a problem with your account. You either had an existing account or there's something new. Now, with regard to folks that would be claiming for unemployment, obviously, if you lost your job related to COVID-19, regardless of the circumstances, you should go online and make a claim. If you're an independent contractor or you are in the gig economy or someone who might not traditionally have been eligible for unemployment, I'd suggest that you go ahead and make a claim. So much of what was in the CARES Act will really make folks eligible for unemployment, meaning self-employed, gig economy, folks who had just started a job, who didn't have enough creditable hours or quarters in their base period, folks who didn't have enough salary in their base period. Go ahead and make that claim. The online connection can handle that. If you need to call, we'll have operators there. We're taking, queuing up people who have incomplete claims for whatever reason and calling them back. We're using a lot of different methods, but we need for you to make contact with TWC for us to be able to start that process.
Thank you, Brian. Next is a question I think everybody has, and heads up, we'll be going to Dr. Hellerstedt and Nim Kidd to answer this question. Dr. Hellerstedt is the Commissioner for the Department of State Health Services, and Nim Kidd is the Chief of the Texas Division of Emergency Management. The question is this: will there be expanded capacity on testing done? Because now we are only testing those with symptoms. Do we need to expand who we test to better understand the impact of community spread. And then let me just kind of add in, if both of you would just provide your level of information with regard to what we can expect with regard to testing going forward. We'll start with Dr. Hellerstedt first.
Thank you, Governor. This is John Hellerstedt. I'm the Commissioner for the Texas Department of State Health Services. We continue to be able to test more folks in Texas every week. As you announced in the press conference the other day, we would expect to hit over 100,000 folks have been tested. There's a couple of different avenues to testing, if you will, and I think that's important to understand. So the one that has by far the most volume is actually the private independent labs. So that would be in a case where a person would go to their physician would deem that testing is appropriate and refer that person to the lab to be tested. So that's in the range of 40,000 plus folks have gotten tested that way in Texas. There's also the public health system, and so the public health system is one that we do free of charge to the patient. That volume is smaller, and although we continue to expand it, and we're hoping to have some additional capacity here in Austin in the central lab before too long, using a new methodology. So, and then the other testing capacity that people are very interested in now is the testing capacity through the instruments that Abbott Labs has that are capable of producing a test result, a positive test result, often within 5 minutes, and a negative test result at the end of 13 minutes. And it's a point of care. It's a relatively small instrument. For those instruments themselves have been distributed throughout Texas for a number of hospitals and private providers for a period of time. Those providers use them to test for things like strep throat and do point-of-care testing for influenza, for example. Abbott Labs has now developed a cartridge, if you will, that can perform the test for the COVID-19 virus as well, and they are supplying that private system with a number of tests that would be available then throughout Texas. Abbott Labs has also made a number of new instruments, if you will, available through the public health system. Right now, that's relatively limited. They're giving us 30 instruments, but only 10 kits, and we can't really divide the kits. So what we'll do is when we get those, when we see them, we don't have them in hand yet, but when we get them, we'll send out the first 10 kits, and each of those kits is capable of testing 24 individuals. So for right now, again, on the public health side, for that rapid COVID-19 test, we have a limited capacity. So testing is important. I don't think we're still at the point where testing of asymptomatic individuals is clearly understood as being beneficial. And the reason is that we have that limited testing capacity, and so we have to use the capacity in a way that we think it makes the most sense, where we're going to have, I believe the governor on the call talked about how we've had rather a steady proportion where about 10% of the people that we test are positive, 90% are negative. That's probably about right. If you saw that half of the people you were testing were positive and the other half were negative, you might suspect that you weren't testing enough people. On the other hand, if you tested very, very broadly and only a small percent of the people you tested were positive, you might say, well, especially when you had a limited resource, the testing resource itself was limited, you may be testing and not targeting it appropriately to get what you need. The purpose of testing really does boil down to public health surveillance. It helps us to know where COVID-19 disease is occurring and where it is increasing in its rate. And as we go through time and expand those capacities that I talked about, I feel confident that the testing capacity that we have will, in fact, be useful for that public health surveillance purpose. Another thing to keep in mind is that the disease is a dynamic thing. It's moving, if you will, through our communities. And as such, I could have no symptoms. I could go get tested today. I could feel very confident that I have a negative test. And yet, again, the infection is moving through the communities, so I could actually acquire the infection the next day or sometime later. And in that case, I might have been given a false impression that I was free of disease and didn't need to worry, or maybe didn't need to continue taking the precautions. So we have testing capacity. If we had everything that we wanted, would we have more testing capacity? Yes, I think that's true from the beginning. But we have to deal with reality. We do have testing capacity that I believe is adequate for the purposes of public health surveillance, and we are adding to that capacity every day.
Go ahead, Nam.
So, thank you, Governor. The only thing that I'd like to add to Dr. Hellerstedt's comments is one of the things that we're reading a lot about now is home testing. And Doc, can you confirm that any of the home test kits are not FDA approved at this time?
Thanks, Tim. That's a good question. Yes, no, we don't believe that any of the home testing kits are FDA approved. One of the things that to keep in mind is we're getting a lot of offers. We're seeing things, if you will, on social media. We're getting offers ourselves for testing that is things like home testing kits or other types of testing that are not approved for human diagnostic purposes. And that's really the key. The test has to be something that is valid for human diagnostic purposes, and in the United States, that really requires FDA approval. The FDA has moved mountains to expedite the licensing under what are called emergency use agreements for various novel or new innovative types of testing. So that's been working very well, and that's been adding to our testing capacity, and that's very good news. But a home testing kit that's not FDA approved is simply not reliable, and again might provide false information, either a false negative or a false positive. So thanks for that point, Nim.
Thank you, Doc. Two things that I'd like to add to the drive-through testing lanes is a far majority of our local governments and their local health authorities have set up their own drive-through testing. We want to encourage this as much as we can. We believe the federal support for drive-through testing may be extended for a little bit longer, but we don't believe they're going to expand the number of sites or footprints for that. And then a little more on the Abbott Labs testing. We believe that sometime around April 1st, Abbott Labs shipped to their existing customers, and I think that's important that we say this, their existing client base, to the 40-some-odd locations that the governor mentioned earlier, these capsules or tests that would go into the Abbott Lab machines to test for COVID-19. We also are led to believe that sometime today, an additional 30 of those machines will be shipped to Texas, but the tickets that go in them or the collection samples will not be received until tomorrow or Thursday. So we'll be working with DSHS to figure out the plan for where those additional 30 sites go across the state in order to fill gaps or places that we know need to be taken care of. And to our local officials and partners on the phone, I encourage you to keep working with your local public health authority and DSHS to let us know where you're setting up drive-through lanes, and if any of the resources that we have, we will happily share with you. I know we're going to have a lot of questions about STAR requests that have not been filled yet, and I'll tell you now and I'll tell you then as well. The only reason that we're not filling STARs is because we may not have the commodity in the warehouse ready to ship. So, Governor, I think with that, we'll turn it back over to the next question.
Okay, while you were on that, and while we have both you and Dr. Hellerstedt in here, let me ask you some more, or let me ask some more questions related to that were submitted. One is, it says, our hospitals are struggling to have enough testing supplies. Examples of what is needed include reagents, viral transport media, and regular flock swabs. And can we have Dr. Hellerstedt or Nim respond to that, please?
Go ahead, Dr. H.
you got I want to make sure everyone understands the question. Hospitals are struggling to have enough testing supplies. Examples of what is needed include reagents, viral transport media, and regular flock swabs. Go ahead.
Hi, Governor. It's John Hellerstedt again. Yes, we're absolutely acutely and, if you will, painfully aware that the supplies related to testing, both the collection kit, as you pointed out, and then at the laboratory level where the testing is done, the testing is not as robust as we would like. We are in a an area of very high scarcity, and I think NIM said it the best. If folks are sending in STAR requests and they're not being fulfilled, it's because we absolutely do not have that commodity available.
Anything further on your part, NIM?
No, the only thing that I would add to our local partners is this is a little bit of a new area where we're working with our private healthcare organizations in our communities. And so we do want you to continue to communicate with them on a daily basis like you are. And some of the reagent pieces in the labs, I believe, and Dr. Hellerstedt may be able to expand on this, actually come from the CDC. And so it's not just a shortage here in the state, it's a shortage across the board. And I really believe the answer to this is going to be the private sector labs that are trying to ramp up as fast as possible. When you look at the percentages of what the local public health labs can do versus the drive-through testing, the biggest growth will be on the private sector labs that are out there. And so we just want to keep encouraging that collaboration amongst those partners, knowing that we're all struggling with it right now. Dr. H., anything you'd add to that?
I agree completely, Nim.
Very good. And sticking to this topic, if we could, kind of going back to that question, Nim, you were talking about, this says, we are a small city in a relatively small county. Our STAR request continues to be denied for test kits. We will run out this week. We need to be able to test our first responders and medical personnel. Can you please help?
This is Nim again, and so, yes, we absolutely want the help. The thing that we will do, and we'll reach back out to the sender of that, but ideally we need to be working with our local labs and local public health authorities. The test kits that are out there, as Dr. H. has said very, very frequently and very true, we want to make sure we're testing the right potential patient at the right potential time. And because if I get tested today but get sick tomorrow, that may not be available. Especially our first responders, police, fire, and EMS that are out there on the front lines making 911 calls every day, not knowing what they're walking into. A vulnerable community from my perspective that we want to make sure that we're safeguarding. And really just working with your local public health authority is going to be the best way to get that done. As the additional tests come in, we will send them out as soon as we get them. We're not holding any of the testing materials in the laboratory in our warehouse. Those are going out as soon as we get any of those. And the same can be said for personal protective equipment. We have a small amount that we are holding for an outbreak, but the rest of the PPE that the governor has been talking about us receiving, we are trying to turn that on a daily basis and ship that out. And so our goal is to get to the point where you call us in Vegas to stop shipping PPE to you. That's what we're trying to get.
Very good. A couple of more questions about testing, then we'll move to some other areas that I know you all have a keen interest in. One question is, can the state provide a list of COVID-19 tests that are FDA approved, state recommended, and a source to purchase them from?
Dr. H., does your team have that?
We can certainly compile it. Again, these things are in very high demand. Don't forget that, again, because there's a requirement that these are suitable for human diagnostic purposes, typically they require what's called a CLIA certification. So that essentially means that it's a laboratory. It's a private independent laboratory. It's a hospital or university-based laboratory that can do human diagnostic testing, or it's a public health laboratory. So there's not anything that non-laboratory-based folks can do in terms of getting valid, CLIA certified, suitable for human diagnostic testing. If I might, I just want to also emphasize, we do want to have more testing. We know it's important. But don't forget, the thing that we really need to keep our eye on is our prevention measures. And those are in various forms, if you will. I think of them as layers of armor. One of them is the social distancing that we've talked about, and we all are feeling the impact of that, the economic impact, but there's also a beneficial impact because we believe that there is light at the end of the tunnel, that we don't know exactly how long the tunnel is, but we can see that the things that we're doing are decreasing the mobility that is taking place in society, and therefore increasing the social distancing. We also see people engaging in far more rigorous hygiene habits, and now the CDC has recommended that folks wear cloth face coverings, and that's because we're discovering that even speaking and breathing for a person who is symptom-free that has COVID-19, they're going to be spreading that virus in droplets in their speaking and breathing, and the cloth face covering will catch that before it gets out into the environment and gets on surfaces. Also things like gloves, the standard things that everybody's been telling us all our lives about hand washing. It really works. All of those hygienic practices, disinfecting surfaces, sitting apart from each other, working from home. Those are the things that prevent COVID-19. And again, we're very sensitive to the idea that has an economic cost, but at the same time, at this phase of what we're going through with COVID-19, we have to avoid a sudden surge in illness that would overwhelm our healthcare infrastructure and overwhelm the numbers that we have. So I think we're enjoying some success, and I think as time goes on and we get more data, we're going to have better models, we'll have better prediction, and we'll have maybe a better understanding of how it is we can thread the eye of that needle and have an economic recovery along with continued containment of COVID-19. So testing is important, but don't forget prevention is really the number one task, in my opinion.
Thank you, Doc. And while I was listening to your answer, I just quickly Googled the FDA's website for emergency use authorizations. It looks like they have a list of the tests and the testing capabilities that are approved. So I think if y'all will just go there and Google it, you'll get it in the real time that we get it if you bookmark that page as new tests come online, what they may look like. And something else that I want to add to my previous answer about how our hospital and healthcare providers are ordering equipment through the STAR process. We've been working very close with DSHS, with the U.S. Health and Human Services responsible for the Strategic National Stockpile, the SNS, and FEMA, in order to make sure that as materials come available to us through any of those means, whether it's given to us by our federal partners, given to us by donations, or bought by our procurement team, that they are being strategically placed where we have outbreak and where we have patient growth numbers. We want to get to the point where not only are our hospitals and healthcare organizations getting PPE, but all of our first responders, all of our assisted living facilities and nursing homes, and all of our jails and prisons. So that will be spread as fast as we can spread it. I know it's, again, a little different process of trying to go through your RAC, your Regional Advisory Council, if you're a healthcare provider, and sometimes our local governments don't have the great relationship that other local governments do with RACs. So what I would ask is that if your healthcare system is trying to order N95 masks through us, that you and your cities and your counties get on the same page with your RAC, know what you're going to need, and to get that request to us, and I promise you we will fill them as fast as we can get the equipment out the door.
Great. Thank you very much. I see that some more questions have come in about testing that we will get to shortly. There were multiple questions that were sent in that want to ask questions about the executive order that I issued statewide last week. Let me get to some of these questions right now because I know that questions like this are on the minds of a lot of you. Let me read a couple of the questions and kind of answer them together. One question is basically, is my executive order 14 a mandatory or voluntary stay-at-home order? It says that the question more specifically is, has the government issued a mandatory stay-at-home order for all 254 counties in the state, or is this order more akin to a voluntary stay-at-home or recommended stay-at-home order. Let me see here. And then relatedly, those are others. Bottom line is, it is a mandatory stay-at-home order for the entire state of Texas through April the 30th. Some other questions, kind of like along those lines. There's a person saying, or asking, or I guess saying, please issue a more strict order for staying at home. We're having a tough time getting compliance because the governor's order is not as strict as the local order. One thing about that is, if you look at the language of my executive order, what it says is that this is a statewide stay-at-home order. Let me explain the analysis behind why we designed it the way that we did and what you can do with regard to stricter orders at home. Obviously, for a statewide order, we are looking to find what is the right solution that would work for all 254 counties, knowing that it's impossible to get one solution that's right for all 254. But the best solution we could come up with was the one that we were able to provide in conjunction with information provided by doctors and data. The doctors include Dr. Hellerstedt, and then also include my conversations with Dr. Fauci and Dr. Birx. And based upon those doctors' recommendations, as well as the data that we had with regard to the growing number of COVID cases in Texas, we came up with the order that I issued. In that order, I made clear that if a county or city wanted to have orders that were more strict than what I applied, the county or city could do so to the extent that it did not conflict with my order. And so you'll just have to go through the specifics of my order to see if it would conflict. But for the most part, it does allow cities and counties to have orders that are more strict. Another question along those lines, let me see here. Is why did we move to a shelter in place when evidence was there that masks could allow us to keep many businesses open as long as individuals wore masks, even if homemade? But the reason is that, again, based upon both input from doctors as well as what the data showed, it would be along these lines. One is we needed to find a strategy for defining who would be eligible to work and who would not be. Understanding two things. In today's society, many people are able to work at home and perform a large number of the tasks that they would otherwise provide. Understand completely that not everyone is capable of working from home. But we needed to come up with a strategy for defining who was needed to work. And we relied upon the U.S. Homeland Security standard of what is defined as essential services to make sure that the machinery of government remains open and is able to fully provide what the people of the state need to have provided, while also ensuring that the people of the state would have access to things that they need, such as groceries and other home supplies, so that they could continue to living their lives as comfortably as they could be. And so that basically is why the order was structured the way that it was done. Along those lines also are questions along these lines. I'll read two of them. One is, how do you envision the process of lifting the stay-home order? What metrics will be used to decide when it's safe to relax social distancing rules and open restaurants and non-essential businesses? And a separate question is, do you see some type of businesses that are not in essential businesses categories being allowed to open prior to April the 30th? I'm going to have Dr. Hellerstedt weigh in here, and I may read the question again, but I want to provide some level of answer based in part on what I've heard from some federal sources, such as recent comments by the Secretary of the Treasury, recent comments by the President, and information that I'm picking up from Washington, D.C. But again, one leading question here is, how do you envision the process of lifting the stay-at-home order? What metrics will be used to decide when it's safe to relax social distancing rules and open restaurants and non-essential businesses? So if you've seen what Secretary of Treasury Mnuchin has said over the past 1 or 2 days, as well as what the President said over the past 1 or 2 days, the federal government, working with the doctors that they are working with, they are working on that very issue. And we are looking to them in part for their guidance on this issue, understanding we may or may not need to have our own standard different from the federal standard just based upon the unique factors that may be existing in the state of Texas at that time. The first thing that we will be doing in the state of Texas is monitoring the data about the number of people who test positive for COVID-19. We need to see if and how long that number continues to increase, and is it increasing at a steep rate or is it beginning to level off? Similarly, we will be looking at the number of deaths in the state, and are those number of deaths increasing or decreasing? Are they leveling off? And so we need a fuller, more accurate picture of exactly what's happening in Texas is the first thing. The second thing is, as I was saying earlier, I know that the Secretary of Treasury, the President, and others, with their doctors, they are working on strategies as we speak to try to figure out how they would define what would be allowed to be open. And let me suggest this to you, because what I'm suggesting to you is kind of a takeaway from my tea leaf reading of what the President may be thinking. The President has said there are certain parts of the country where there is no COVID-19, where there is less of a threat than what you see, say, in New York City, for example. And as a result, the perception of some in Washington is there's no need to have everything shut down when it seems like the risk is low. So what I think the President and his team will be looking for is, where is the risk low or minimal or maybe even non-existent, such that there could be some level of opening up. So I can't tell you how they are going to decide that or when they are going to decide that, other than I have a feeling they want to try to decide that by the end of this month. But I will tell you this, there's something that you local leaders can do about this. You can do the most you possibly can over the next several weeks to minimize the spread of COVID-19 in your community. Because what they will be looking at, among other things, are the metrics of what's happening on the ground. And so the more you can minimize and reduce, actually, the spread of COVID-19 in your community, the greater chance that your community will be better positioned to be one of the early communities out of the gate when it comes to being able to reopen businesses that are not currently labeled or considered to be essential businesses. Now, with that, I would like Dr. Hellerstedt to weigh in and provide his perspective.
Thank you, Governor. I think you did an excellent job of summarizing really the key elements that are needed in order to start making some of those decisions. These are difficult decisions. Like I described it earlier, it's sort of threading the needle, if you will. So let's make sure that we understand a certain perspective on this. We call this a novel virus because it's never circulated in human populations before. And that means that there is no pre-existing immunity in any human population. And you can see what happens in countries where essentially the kind of mitigation and containment things, the social distancing that we have implemented in Texas, where that was implemented too late. And Italy would be a great example of that, and where it broke out in China would also be a great example of that. And in a way, what's happening in New York City, in the tri-state area, in the Northeast, is an example of that. They're really in a very tragic situation where they are straining at the limits of their healthcare infrastructure, and it's something that we want to avoid. So keep in mind that until we get a vaccine or until we get an antiviral medication that we know is effective and safe at interrupting the cycle of disease for COVID-19, even when we start to see that our social distancing, our hygiene, and our sanitation and cleanliness, we're seeing the beneficial effect of that means, though, that there's still a large population of people who are going to be vulnerable. You will not have completely, if you will, doused all of the embers of this forest fire. And so when you start to relax and walk away from that setting, there's always the chance that it'll reignite. I would agree completely with the governor again saying that at the national level, this is, I think, one of the hottest topics that's out there. What exactly can we do once we've bent the curve? So we are looking at a trajectory that does not overwhelm our healthcare infrastructure. How exactly and what exactly can we do to allow some returns to normalcy? So one of the questions, I believe, was about why are we doing this now that we know that face masks can prevent it? I'm not sure that we know that for certain. We believe that is helpful. But remember, it's helpful because it's not that it keeps you necessarily from getting it. Having a face covering, cloth face covering is the term that the CDC is using. So that could be anything from a bandana to a homemade cloth mask or something of that nature. The purpose of that really, the effect of that is to keep persons who are asymptomatic or symptomatic from spreading the disease to others. It doesn't necessarily keep you from getting it. We don't know how effective that is, but I do believe that it makes sense that it will have some effect. I do believe that things like wearing gloves out in public, and then you get that to get your groceries or your mail or whatever, you come back home, you wash the gloves, you take them off, you wash your own hands, and you've added an extra layer of protection. How effective are those things? How will those be techniques that will, in fact, allow us to have a selective return to some normal? That's where I think we still need to stay where we are in terms of the preventive measures we put in place, gather the data, and make sure that we're really bending that curve, and then at the same time, in parallel, be looking at ways that we can start to return to normal. I'm confident that there are such measures, and I'm sure that we'll be able to engage in dialogue with our federal partners who understand, as we do here, that this is one of the biggest questions facing us, because we've got to find solutions to that problem.
Great, thank you, Doctor. Let's see. I'm going to continue with several other questions concerning the executive order that I issued about the stay-at-home policy, except for essential businesses. I think, Nim, this will be a question directed to you. The question is this. I've had multiple businesses submit inquiries to the Texas Division of Emergency Management for designation and clarification on their status as an essential service or activity. Can someone advise as to what the current time frame is as to when they should expect a response?
Yes, Governor, I would love to be able to give a day and minute time frame of that. We did have literally thousands of questions that came back in. We're sending back those as quick as we can, but the far majority of them really were clearly written in the guidance. It's just maybe people needed to read a little deeper into the guidance to see if they were eligible or not. So our team is working hard to get those answers back out. I'm hoping that maybe by the end of the week we'll be caught up, but that all depends on how many more get submitted.
Very good. All right, there's a couple of questions about my executive order that also raise some questions about local control. I will answer them in part, but part of the answer may need to come from Attorney General Paxton. And I want to make sure he's on the line and is unmuted. I don't know if I need to get the operator to unmute his line or not.
Am I here? Can you hear me?
I sure can. All right. So let me ask the question and answer it to the best of my ability, and then you can weigh in as you see fit. So the question is this. It basically says, I want to urge the governor to continue allowing local county judges to make adjustments to their local disaster orders that fit what is best for their county. And this in a way is in relation to a question I answered a little while ago, and that is that there is local control flexibility still allowed in the state of Texas for county judges to make decisions best for the county, as long as those decisions are not inconsistent with the executive order that I issued for basically a stay-at-home policy, except for people providing essential services or people seeking those essential services, like going to a grocery store. That said, there may be some issues that have to be defined about what exactly is meant by local control that may be up the alley of the Attorney General. General, did you want to weigh in on that at all?
Yeah, I think you answered it really well, Governor. All I would say is each one of these questions, I mean, it's hard to answer that broadly. Each one of these questions sort of has to be looked at on a case-by-case basis, because normally we're just going by our constitutional requirements, our statutory requirements. With the disaster relief that's going, the disaster declaration, I mean, that changes some of the things. So I would just say we're open to answering questions about that, because every factual situation is going to demand a different answer.
So along those lines, I'm going to ask a actually more detailed question. And General, I'll have you take the first crack at answering the question, and then I'll follow up. This comes from a mayor in a West Texas town saying that we want to restrict the we would like to restrict the number of shoppers in our grocery store, Walmart, and dollar stores. Will you allow cities to make this decision locally? Because we have 10 COVID-19 cases in our county, and we would like to not have any more. And is there anything from your perspective about the restrictions and their ability to impose restrictions about numbers of shoppers in grocery stores and things like that?
Yeah, I know that I don't have your exact wording in front of me for that as it relates to essential businesses, but as long as it doesn't contradict exactly what you said in the executive order as it relates to grocery stores, and obviously they're an essential business, I would think they could have some latitude.
Right, and I agree with that. And so my executive order did not specify what standards grocery stores were required to abide by, other than the general notion that anything that is open should follow the best practices as articulated by the Presidential Commission as well as the CDC. And the one thing that they do articulate is the need to achieve distancing. What we have seen at some grocery stores, the ones I've heard about in the more urban areas, is, for example, at checkout stands, they actually have tape on the store floor separating shoppers by 3 or 6 feet, whatever the distance is. And they have some other distancing practices, and I have heard of stories about some stores limiting the number of people who are allowed into a store at any particular time. And then whenever someone exits, someone is allowed to enter. And I would assume limitations like that, if you want to, they could be imposed at the local level, whether it be a city or county. And put it this way, that would not be inconsistent with the executive order that I issued.
And Governor, Governor, can I add something? Any mayor, any county judge, any commissioner of a county, or any emergency management director can ask us a question under these provisions. So if they want to ask a question, they just need to send us an email at disastercouncil@oag.texas.gov. I'll say that again, disaster-council@oag.texas.gov, and we'll be happy to answer any questions. And the more facts you can give us about what you're doing will be helpful.
General, I don't know about others, but for me, on my line, it broke up, and I couldn't tell between the word disaster and between the word council. Is there a hyphen or dash?
Yes.
Got it. How do you spell council? Is it COUNSEL or CIL?
It's SEL. COUNSEL.
Very good. Okay. Let me see another question along these lines. It says, in considering violations of the governor's executive order, this requester says we have a county prosecutor in this county who stated that on cases where we are forced to exercise enforcement, the county prosecutor will not take the case. The county prosecutor's statement was that the governor's order was basically invalid and or did not provide clear direction on how to prosecute. The county judge says, I personally did not see it that way, but I'm not sure since this other person is the county attorney. I'll answer this in part and let the attorney general answer in part, and that is first, a governor's executive order in time of a disaster has the full force of law. And so it is a law that the county prosecutor both has the authority to and the obligation to enforce. Second, it is clear from the executive order what the penalties are, and that is it's a $1,000 fine or up to 180 days in jail, or both. And any law enforcement officer in the state of Texas has the authority to enforce those penalties for any violation of the executive order. What I didn't read, because I didn't want to cover the entire question, but before that, there was a paragraph about potential violations at bars, restaurants, food courts, gyms, massage parlors, and things like that. And all of those locations that are acting in ways inconsistent with the executive order are subject to legal prosecution. And so that said, but also, General Paxton, let me add kind of another question to it. What does the county judge do if the county prosecutor is not going to prosecute the case? What I don't know is if do you have the authority, or what's your recommendation about authority to be able to prosecute something like this?
Yeah, so I'm just, again, recommend that they contact us, and we'll look at the individual facts. And, we have the ability to go in and seek a restraining order or under your executive order, depending on what the facts are and what they're not doing or what they are doing, will be the specific answer. But certainly feel free to contact us, and if we have the ability to do something about it, we will.
Okay, next question is, are golf courses open, or say otherwise, are golf courses essential services? As much as it pains me, I have to say, no, golf courses are not essential services, and hence are not open. And obviously, under my order, people are allowed to walk around in parks as long as they are distancing themselves from others so that they are not spreading COVID-19. I guess you could consider a golf course to be a park, and you could walk there. Under my executive order, there should be no employees or staff there. Again, the goal is very simple. We want to use this month to make sure that we reduce the spread of COVID-19 so that we will be a state that will be allowed to open up sooner, earlier, and more to get our economy going. And the best way to achieve that goal is by having not only what are categorized as essential services open, keeping others just staying at home, work on your chip shot in your backyard, and get ready for a good game of golf sometime soon. Let's see. There's one more question in a way along these lines. Let's see the question here. But basically, there's several questions regarding religious gatherings. If we local officials are telling our residents that staying at home and away from other people is the way to curb the spread of the virus, which is correct. But yet, you, being me, the governor, have made the exception of going to church if they practice social distancing. Common sense says that worship via video conferencing, not public gathering, should be practiced if we're really serious about curbing the spread of the virus. all I can say is I agree with that. That is common sense, and that common sense is accurate. I will tell you that I've talked to church leaders around the state, and I haven't talked to one yet that wants their members to get sick and maybe die. And they want to ensure that their members don't contract COVID-19. It would be a disaster, not just for the community, but also it would be a disaster for that church, for their membership to contract COVID-19. And so, as I said in my press conference, and I think it says it specifically in the language of the executive order itself, that churches are required to practice safe standards that prevent the spread of the coronavirus. That said, the Attorney General, working with my office, came out with a detailed explanation. General, if you're still there, I don't know if you want to add more about that.
Yeah, no, we've got those guidelines we can send out that are much more detailed that would take me a while to get through. But I will say this, we have talked to numerous church leaders, and I agree with you, Governor. I don't think there's been an exception so far where they haven't agreed to do their services online, or I think some are contemplating doing it, by cars. Like we talked to a pastor today up in the Dallas area who is going to do Easter services with people in their cars, and he's talking about he wanted to know the distance the cars had to be apart. So far, I mean, we've had some concern with certain pastors, but as far as I know, every single one of them that we've talked to has kept the guidelines where they're not meeting person to person.
Very good. Let me move on to another question. This is an important question for local officials that's coming up really quick. The question is, I'm concerned about the May 2 local elections. I understood the Secretary of State had postponed them, but by Monday heard that the elections were okay as long as social gathering or social distancing was mandated. It seems easier just to put them off. Local matters are not worth the risk. And so basically are the May 2 local elections postponed? Here's the deal. I had the authority as governor to waive a particular statutory provision that empowered local officials to postpone the elections. As understood the law, I personally did not have the legal power to personally postpone local elections. It's my understanding that most localities have postponed their local elections, just like I postponed the primary runoffs that were scheduled in the latter part of May, moved them to July. That said, I would first of all refer you to the Secretary of State's office. Unfortunately, we do not have the Secretary of State on the line with us today. But first, talk to the Secretary of State about solutions. But General Paxton, I don't know if you have anything that you wanted to add to that or not.
No, I think you've got it exactly right. It's a local decision about local elections, and you have the authority under state law to deal with the state elections.
Okay. Again, something completely different, but just going through some questions that have come in. Will there be any efforts made to allow senior citizens and others to use their SNAP benefits to pay for a grocery delivery? And I tell you what, I should have said this before I asked the question. This is one, this issue is an issue that is dealt with by the Texas Health and Human Services Commission. And I know we had on the line earlier, and maybe still have on the line, Bill Wilson with Texas Health and Human Services Commission. Bill, if you're there, and if you're not, we want to make sure that the operator unmutes his phone so he will be able to answer the question.
And yes, to have your phone unmuted, please press *1.
And while Phil Wilson may be working to do that, I'll re-ask the question so he and others will know, and that is,
Governor?
will there be any efforts made to allow senior citizens and others to use their SNAP benefits to pay for grocery deliveries?
Hello, Governor. This is Phil. How are you, sir?
All right. Thank you for your help.
Yes, sir. Yes, sir, we're exploring that right now. We've done a couple of things on SNAP benefits getting away the supplement nutrition program, and that would be including fully loaded cards up to be available this week. for those individuals who receive those benefits. We're also exploring how to work to get quick food service and hot meals added to that capacity as well. As part of those programs, we're working with the option of a waiver request with the U.S. Department of Agriculture to have that option added. So that's in consideration right now, and we're working through that process.
Very good. Another question, very important question, and that is, it says we are working to identify physical locations and prepare the physical plant, but the key need will be supplying staffing. And when I say location, let me go back and explain. They're talking about hospital and medical care locations. So we are working to identify hospital and medical care physical locations and prepare those locations, but the key need will be supplying and staffing. Are you prepared to help with this? And if so, how many days does your plan require from the day you decide to stand up a hospital to the day the state of Texas will have it open and ready to serve our community if needed? The answer is yes, that the state of Texas will be prepared to assist you in that process. There are multiple ways this process can be handled. One way that we have done a facility right now is in conjunction with the United States Army Corps of Engineers and the Texas National Guard, and they were able to get it stood up in, it seemed like it was 5 days. I know that it was less than a week. I was very impressed. The key thing is the identification. That takes several days to identify the location, and candidly, it would depend upon which community. Let me state it differently. Each community, it could be a large metro area or a small rural area. Each community will have multiple different potential locations and maybe no location, in which case something like a medical tent may need to be put up. It just depends on a variety of factors. But maybe there are two good people to talk to about this. One for the physical facilities. The person to talk to about that would be Nim Kidd, Chief Nim Kidd, with Texas Division of Emergency Management, who probably is on your speed dial. If not for some county official in your county, he will be on your speed dial. Another part of your question dealt with the staffing for these facilities. And so even if the Army Corps of Engineers puts up the facility, local officials will still be responsible for providing the staffing. But I want you to know that in the supply chain team that we've developed, that includes Dr. John Zerwas, who many of you may know is an immediate past member of the Texas House of Representatives. In fact, he was the chair of the Appropriations Committee in the Texas House of Representatives. But he is leading supply chain efforts for hospitals, including staffing of hospitals. And he would be a person to contact about staffing hospital facilities. He's not with us on this phone call. I'm more than happy to give you his I was just told he's on the call. Do we have Dr. Zerwas on the call? Dr. Zerwas. Let's have the operator.
Yeah, no, I'm here, Governor. We're just passing the microphone around. Yeah. So thank you for that. You've explained it really quite well. We've divided up the various physical resources into a 1 through 5 category, as we all presented last Friday, as a matter of fact. And so that sort of described the physical capability that could be in any given community out there.
But as I was leaving,
is that?
That's not me.
Let's let Dr. Zerwas continue.
Yeah, so we're working with the local communities as well as the people here at the Department of State Health Services to identify various resources within those 5 categories that could be used to meet the needs of the epidemic. And we're very pleased through the efforts that you made through your executive decisions that we've increased capacity substantially, and really feel very comfortable with the level of capacity that we have in our hospitals, as well as some of the outside facilities that could be mobilized. none of that matters if you don't have doctors and nurses and respiratory therapists there to take care of the patients. There is quite a bit of physician and nursing capacity out there that has really been sidelined a lot right now because of, just the nature of the epidemic. And so those are people that can step into alternative specialty areas, if you will, with the appropriate coaching and direction and stuff. We've also really pumped up our volunteer efforts, and so we have on the Texas.gov site, there's a place where people can volunteer. We have well over 700 people that have already signed up to that without there being a really big plea out there to have people come in and volunteer. We're making sure that works. It needs to work a little bit better than it worked in 2017, where we had a little bit of difficulty of connecting the various facilities up with the volunteers. And so we're actually working with Deloitte to tune that up today, and we're going to start testing that tomorrow to make sure that it's ready to go when there, in fact, is a surge need out there. So, Governor, we've tried to address both the physical capacity as well as the manpower capacity through a whole number of different things. The regional advisory councils, or the RACs as they're referred to, are instrumental in making sure that we have some group of people out there that's kind of monitoring this and can kind of be the go-to group, if you will, in terms of identifying what those needs are. That's incredibly important in our rural communities. The RACs are key to connecting the smaller rural communities to the higher level of care facilities. And there's things that you can do to help, make that work better, such as telemedicine and stuff. We've got some good examples of how that's been used out there. So I would say, we're going to continue to really develop the manpower issue and work with the local communities to define whatever physical assets need to be tuned up or put in place.
Thank you, Doctor, very much for that. A question I'm going to ask the Attorney General to participate in the answer in. So, General, if you could be on your ready. The question is this, and I bet this comes up a whole lot around the state. The question is, if a mayor/city council and county judge/commissioner's court do not agree on restrictions in local declarations as to incorporated areas, whose decision is the final decision? And I would like to defer that question to the Attorney General for answer.
Hey, Governor, could you repeat that?
I'd be happy to.
That's the whole question.
If a mayor/city council and county judge/commissioner's court do not agree on restrictions in local declarations as to incorporated areas, whose decision is the final decision? Obviously, it could depend upon some circumstances of which you would want maybe some more information, but you might be able to give them some broad-based guidelines about how to go about getting an answer for that.
Yeah, and I don't have a specific answer because I don't know the facts, but what I would say is if it is a decision that is sort of a county-wide declaration, just like yours would be a statewide declaration, I would say that the county-wide declaration would override a city. But again, you could get into facts where it doesn't necessarily conflict, and so I would want to say if you have that particular situation, please ask us. If we have those facts, we can make our way through it and help.
Thank you very much. Another question we have, this is kind of moving to a different topic, but I know several people have this on their minds. It basically concerns the prison system, and I have a specific question, but I'll speak more broadly also about what's going on. Let me see. The question is, I've been approached by numerous people that work for TDCJ that are very concerned about the transferring of prisoners from unit to unit. It says that it's still happening just as it did before COVID-19. Why is this being allowed and what is happening? And basically, are TDCJ prison transfers still occurring? And that's a subset of the larger question about what's going on in the prison system. So we have worked closely with Brian Collier, who's in charge of TDCJ, and he, before all this happened, had a well thought out and designed plan about how to deal with both inmates and prison guards and the entire law enforcement staff in a prison system about how to approach this, and everything that we're hearing, they're executing it consistent with their game plan and very well. That said, let me give you some specific answers to this particular question, and that is transfers within TDCJ severely are restricted, but some transfers still have to happen. For example, for medical treatment. That said, TDCJ has stopped transfers from county facilities that have COVID cases. They do work to accept necessary transfers from those counties once a 14-day period has either elapsed or a process for that has been established and has been executed. Bottom line is that's just, if you would, one of the minute ways that TDCJ is working on this. They have broader-based strategies to isolate those who do test positive, whether they be inmates or the law enforcement officials working there, working to make sure they safeguard the healthcare, understanding that an outbreak of COVID-19 in a prison or jail setting would be a big-time challenge, and their job is to mitigate that challenge, to reduce it by using their strategies. A couple of questions about something that happened this week, and that is the closure of state parks temporarily, hopefully for a very short period of time. Question is, do state historic site designations like courthouses have to be closed in light of the state park closures? The answer is no. We did close the Texas Historical Commission historical sites that the commission operates. This does not apply to private sites within a historical designation, and certainly does not include things like courthouses. Let's see. A question about schools, ISDs, and education. And most questions about schools and education would require consultation with Commissioner Mike Morath and his team. They are not with us today, but I think I'm going to be able to answer this question. Here's the question. What oversight or authority do city leaders have to oversight unless overruled by the DEA commissioner? Basically, I think they're asking what level of oversight do local leaders have? And my suggestion is this, and that is work with Commissioner Mike Morath. I know that he wants to work collaboratively with local officials to achieve the right result for that particular area. And if a local entity is unable to collaborate with and reach an agreement with the commissioner on what the right solution is, for example, let's say Morath thinks one strategy, but the local officials think, well, it's far too dangerous to do that. I would suggest that you work with the Office of the Attorney General to hammer out a solution. I know that sounds like it's dealing with multiple agencies, but we all understand that we have a need for speed, and all of these agencies are prepared to work quickly with you for the right solution. All that said, let me tell you this, and that is that as you know, pursuant to my executive order, all schools are closed down until at least May the 4th. And we will not know until mid to late April what any clarity looks like about whether or not schools could open up on May the 4th, or if they need to remain closed longer than that, and whether they open or whether they close, what it's going to look like with regard to the ongoing provision of education to our students. We simply don't know, because we don't know what the status of COVID-19 in Texas is going to be. Give us another couple of weeks. Again, if all communities do their very best to slow the spread of the coronavirus, it will provide greater clarity for all of us in all of these decisions that have to be made. A couple of specific questions here. Question is, will the Texas Water Development Board Flood Infrastructure Fund deadline for applications be delayed? I'll repeat it. So this involves the Texas Water Development Board Flood Infrastructure Fund, and there's a deadline for applications. Will it be delayed? and we've reached out to the Water Development Board, and they've answered the question. The answer is the deadline is currently May the 14th, but the Texas Water Development Board has now extended that to June the 15th. So we go back for anybody who wants an application with the Texas Water Development Board Flood Infrastructure Fund. The deadline for applications has now been moved back to June the 15th. Another question involving TCLO. The questioner says, per our conversation, TCLO's headquarters testing location is available for those who need to take the state licensing exam. To schedule an exam, they can reach out to, I'm sorry, I was reading the answer. Now I'll tell you the question. The question is, can the governor look into allowing special requirements for academies in final phases to be released immediately for state testing to fill out much-needed positions within local and county law enforcement agencies? And you already know the answer. And that at TCLO's headquarters, testing location is available for those who need to take the state licensing exam. To schedule an exam, they can reach out to Director Michael Antu. I'm going to give you his email address. It's Michael, that's MICHAEL .ANTU at TCOLE.TEXAS.gov. So basically, this is any TCLO related question. If you would reach out to Director Michael Antu, his name is MICHAEL .ANTU at TCOLE.TEXAS.gov. Next question, we got time just for a couple of more, and we have to close this off at 4 o'clock. But a question about what's going on basically with the border of Texas, Louisiana, what DPS is doing there, and more specifically is this question. The questioner says, I have concerns about DPS troopers who are working along the Texas-Louisiana border bringing back the virus to areas that don't have it. And if they go back, are they going to quarantine themselves before returning? So the answer comes from Director McCraw, who is the DPS director, and he explained to me this. Health evaluations of these troopers are done both before and after every shift. So they will check the temperature, et cetera, and do physical and health evaluations on them before they start their shift and when they return from their shift. During their shift, they have PPE to help ensure the safety of their health. But also there's ongoing monitoring of the health status of these DPS officers because obviously, for one, DPS doesn't want their troopers to contract COVID-19 and don't want it spread among the DPS ranks. And that is consistent with what this local official wants, and that is to make sure that it's not spread among their community. Let's see. A couple of more here. This one looks like some questions involving health and testing. And Dr. Hellerstedt, this one may be coming to you. Let me read the question. Give me 1 second to get to the question here. So there's kind of a multi-part question involving a county that maybe a lot of counties would have these same questions. What are counties doing to get more testing done? That's kind of been answered, to help determine the infection rate in their area, which I'm not sure if that's been discussed, but the issue is kind of determining the infection rate in their area. And then secondly, there's this question. There's been a proposal to use in-home serology tests, but best we can tell, they're not authorized. I think you guys may have discussed it earlier. And then it says, if we use these types of tests, would the positive test be counted in the confirmed positive category for the county and state count? You need me to repeat that, Doctor?
Well, let me take a stab at it, Governor. So first of all, one of the things we are trying to do is, with the data that we do have already, through public health, which includes both the commercial lab system and the public health lab system. We are doing our best to be able to display the data that we have on a county-by-county basis. So we are rolling that out, and hopefully that will be helpful. The in-home testing, again, as we said earlier, I'm not aware of any one that would be FDA approved, and in other words, suitable for human diagnostic testing. And the question also included, I think, a really great point, and that would be, I can't imagine any system of in-home testing, even if it were approved, that would actually then be able to reliably feed that data into public health, and therefore its value in public health surveillance would be very, very much diminished. Also, how can if I test let's say there was such a thing as a valid test, how could I, if I took that test and got a result, either positive or negative, how could I provide those results to someone else that they could rely on the results of that testing as well? So that's why, again, it's most useful that we have a system that enables us to gather all of that data and use it for surveillance and use it for those other purposes. So I hope that answers the question. I'm glad to take another stab at it if I didn't get all those points.
Sounds good. Thank you very much. In a way, kind of related to the first part of that question is this other question. Dr. Hostad, it may come to you. The question is, why are city mayors not provided information on those residents that are infected? Let me read the next sentence to you. It says, our first responders know, but we are left blind due to HIPAA restrictions. Do you have the authority to grant such?
This John Ellis said again, I don't believe that my authority as the commissioner for the Texas Department of State Health Services gives me any authority over things like HIPAA, which are federal laws. And so I think the short answer is no. Again, we are hoping to host data at least a county level by the state. I am aware, I believe that, for instance, here in Austin, the Austin Travis County Health Department has made data available on a finer granularity than that. That's not something that we have undertaken at the state level, and I have great reservations about publishing data on that level of granularity, again, for the reasons that were cited in terms of privacy concerns. Over.
Okay. Two more questions, and then we have to go. Dr. Ellis said this one may be for you also. It says, is there any indication that we will soon have a figure to report regarding the number of persons who have recovered from the coronavirus in Texas?
Well, in a way, we can imply that from the testing that we have done, the positives, and the time at which the positive test was taken, and then comparing that to anybody who survived the illness after a period of time, they are going to be recovered. I think one of the other interesting questions that I know is being considered at the federal level is, can we test people for an immune response and do those tests reliably tell us whether or not that person, in fact, is immune to the extent that they could not be reinfected? Those are areas of very active scientific research, and when we get the answers to those, that's going to possibly open some avenues towards how to respond and measure the COVID-19 outbreak.
Very good. And then the last one is kind of related. Have the ones that were tested positive and have recovered, are they still in the total count of confirmed cases?
Yes, basically what we're doing is keeping a cumulative account. So it is the total number of individuals who tested positive ever right now. And we are working on a way a methodology to get at that number that people are asking about. In other words, the people who have recovered. Again, that's a work in progress. Over.
Very good. Well, listen, Doctor, thank you. I want to thank everybody on this call, including Congressman Brady, Attorney General Ken Paxton, Dr. Hellerstedt, Dr. Zerwas, Phil Wilson, Brian Daniel, everybody else, everybody on the team here for the answers. And thank you all, most especially those who are on the front lines of this, working at the local level. Thank you for your questions. We need to continue this on at least a weekly basis to make sure that we get your questions. Do you want to provide that right now? Okay, listen, while we have you here, we have Nim Kidd with us right now. And he has an important message for you, for people pretty much across the entire state of Texas about weather-related issues coming tomorrow. And so it doesn't deal with COVID per se. But if you would, this is Chief Nim Kidd with Texas Division of Emergency Management.
Thank you, Governor. And from our weather update from Wichita Falls, Abilene, San Angelo, down into Del Rio, everything south and east of there, please pay attention to your weather forecast for tomorrow. They're predicting for the central Texas area, Waco down to San Antonio, the I-35 corridor on both sides, potentially up to 2-inch or larger hail, high winds, with about a 2% possibility of tornadoes. So while we're all focused on the coronavirus right now, we need to make sure that our regular business is still operating. So please pay attention to your local partners. The state will be putting resources on standby to assist tomorrow if anything breaks out. And if you have any questions, contact your district coordinator or the State Operations Center.
Thank you, Chief, for that. Obviously, we're all kind of focused 24/7 on the coronavirus, but we all know the usual standards and practices in emergency management. And just plug in your typical emergency management response efforts as it may concern your region as it gets impacted by these heavy storms that will be crossing Texas tomorrow. Let us help you where we can. Thank you again for all that you're doing, and we will work to continue to stay in touch with you and, very importantly, answer your questions. Thank you all so much, and have a great day.